You should come raising with you the problems in our National Ambulance Service. And there are many problems. The staff are doing their best, but there's problems beyond their control. And I'm going to name out some of those. There's not enough staff or ambulances. We have approximately 1,500 staff. Scotland is more than double that, with a similar population. We have 675 operating ambulances within the service. Scotland has more than double that. There's a problem with so-called dynamic deployment. And I really want to push you on this. Dynamic deployment. And what that means is the ambulances can be sent anywhere. An ambulance based in Laois could be sent as far as Cork or Waterford and are being sent that far. And when they're almost at their destination, within a couple of miles of it, they can be turned back because a local ambulance has got there a minute or two quicker. A crew can do 600 kilometres plus in a shift and only pick up 1 or 2 patients. Recently, in Laois, where an ambulance crew was on, and only 1 ambulance crew was on, and 1 ambulance, the crew clocked in and were immediately sent to Wexford. Meanwhile, Laois was left without any ambulance. There's 1 ambulance station, and on a Monday and Tuesday night, there's only 1 ambulance on. An ambulance can take up to 2 hours or more to arrive within the county because of this, or not arrive at all, and that's no fault of the staff. And as I said, Monday or Tuesday night, only 1 ambulance can be on, and that can be sent as far away as 3 counties, and that is actually happening. There's a recent death of a young person less than a mile from the hospital. There was no, and from the ambulance base, 1 ambulance base in the county, and there was no ambulance available to pick up that child. 2 ambulances were on at that stage, and the 2 ambulances were sent out, were gone to another county. We have less cover than we had 15 years ago in the county, despite the fact that the population has increased by over 40% and it now stands at over 100,000. And to add to that problem is the problem with the rapid response vehicles. That's the cars with the advanced paramedics. There's less cover now. The operators of them did bring them home, and they would go, if they were called, whether they're on shift or not, they would leave from their home and rapidly deploy to the scene of an accident or an emergency. They're not now doing that because some genius decided that they'd benefit in kind because they had this car with all the signs on it and that they might be doing the shopping in it or something like that. Now, as a result of that, they're left at the base, and that cover is now, that extra cover is not there. That was being done voluntarily by people. And then we have the staff shortage and retention problems because of burnout on top of all that. The Medical Times reported earlier this year the critical shortage of advanced paramedics is endangering life. And yes, there are targets, and I have it here, replies to a parliamentary question I got recently. And in a life-threatening illness or injury situation, they have to reach that by 19 minutes, 18 minutes 59 seconds to be exact. But they only do it win 45% of the time. So, I mean, if you set a target that low, of course you want to meet it.
Deputy.
It's ridiculous. So the question is, Taoiseach, will you put an end to the so-called madness of dynamic deployment? Will you invest in more ambulances and increase the number of staff available? And will you step up recruitment immediately?
Thank you, Taoiseach.
Thank you, Deputy, for raising the issue. And look, at one level, the National Ambulance Service and pre-hospital emergency care has been transformed in the country over the last 20 years in terms of the professionalisation of EMTs and of the whole response. And I think that has to be said, and there has been very significant investment in the service. In 2025, 8 million for new service developments, for 180 additional posts in the service, and increased capacity for aeromedical services. Like total staff numbers now are at 2,430 as of August. That's a 25% increase since 2020. So 502 extra people into the service. And 85% of that staff working in direct patient-facing roles. The issue of dynamic deployment is an issue that has arisen since the configuration was developed many years ago. And at a surface level, I can instinctively empathise with your point, because it does mean ambulances are travelling long distances and so on. And I think we have to respond to this in an evidence-based way. So I do think, I'll talk to the Minister for Health and have further engagement with the National Ambulance Service and the professionals involved as to what is the optimal deployment of staff and ambulances, what's the best way to do it. In Dublin, for example, there's been a unique situation where you have the Dublin City Fire Service has provided a very effective and efficient ambulance service for many, many years. And the HSE and themselves were arguing in the toss as to how to reform and configure. And my own view for a long time, if it's not broke, don't fix it, in that context. And we should be open to examining what's the optimal way to deploy your resource. Now, many professionals will say what they're doing is the optimal way to do it. I think you're articulating a different perspective. I respect the points you're making, but I do think we probably need to look at this in a more evidence-based way, and perhaps the Oireachtas Committee could examine it in more detail on health. But the professionalisation of the service, the development of HEMS, for example, both in 2 services now, 2 dedicated helicopter emergency medical services, for example, all that significant expansion and is enhancing our response. And the key response, as you know, is an EMT or the first responder who's qualified and professional, can save lives. And to be fair, there's been a lot of very, very positive reforms, a lot of significant investment in the last number of years in this service. There has been issues, and the Oireachtas, members of the Oireachtas from time to time have raised the issue that you
now, Deputy Stanley.
The issue is correct in relation to the investment, and I see the figures there, but you're not going to get the benefit of it because of the way it's configured at the moment. And just, you mentioned the word evidence. I'll tell you what the evidence is. You have a county left with no cover because the one ambulance is on cover, is gone 2 or 3 counties away. That is not a situation that can be left to continue. And that's the way Laois is being left 2 nights a week, that can happen. You have where somebody's injured or life-threatening situation, a mile or half a mile from the hospital, there's no ambulance to collect them because the 2 ambulances that are there during the day have been sent off somewhere else. I'm not arguing for them to be kept within a strict limit, but there does need to be a radius, Taoiseach. When I raised this before, I raised the case of a farmer lying in a farmyard for 2 hours here a few years ago because there was no ambulance. You know, in the Clunislee area, there's no ambulance in Portage to go out to assist them. And what I'm appealing to you to do is that the officials will give you answers and they will give you figures, they'll blind you with them. But you need to look at the reality of what's happening. And I'm spelling out the reality for you here in black and white. Dynamic deployment, and I'm asking you to review this dynamic deployment. The government needs to do it. And invest in more ambulances and step up recruitment.
Thank you. Taoiseach to respond.
Yeah, but to be fair, like about 430,000 urgent and emergency calls in 2024. That's what we're talking about, the scale of this issue. With 32,000 calls increase, that's up above the previous year, 32,000 extra calls, 8% in 2023. And you've done the stats in terms of the performance is improving, 72.5% in 2023 to 73.2% against the 75% target for life-threatening cardiac or respiratory arrest. We have to look at alternative care pathways as well. You mentioned the rapid response car. I've had experiences myself where that's been far more effective, fast, in cases that maybe didn't quite require an ambulance, but once you had the confidence of either a GP or a medic who can say, look, we can manage this in a certain way and get the person to a hospital. So we have to use the resource to the optimal. That's the objective. One of the biggest issues has been turnover time at hospitals in times of high demand in emergency departments, for example.
Thank you.
And they're working on that in terms of improving that outcome.
Now,